Okay, guys, so next we are going to talk about healthcare reform. Healthcare reform is a very controversial topic, but it is very pertinent to healthcare workers to stay informed and know about healthcare reform. Healthcare reform is an agreement that improvements are needed to control costs and increase access to healthcare. There are, again, this is a controversial topic, and many people have different views on healthcare reform and how to do it, who should do it, and whatnot. And it could become a very political issue as well. Disagreement and controversy about how to improve things certainly occurs. And back in 2010, the Patient Protection and Affordable Care Act, that ACA, the PPACA was passed. And this basically put three primary goals into law. It wanted to make healthcare more affordable. So health insurance it became available to more people. It was expanded to more people. The law provided consumers with subsidies or premium tax credits that lower costs for households with incomes between 100% and 400% of the federal poverty level. Another goal was to expand Medicaid, the Medicaid program, as I was saying to you in a previous PowerPoint recording. It wanted to expand Medicaid to cover all adults with income below 138% of the federal poverty level. However, with the ACA, the Affordable Care Act, not all states were able to expand their Medicaid programs. Only certain states were able to do that. Another goal of the Affordable Care Act was to put in place support innovative medical care delivery methods that were designed to lower the cost of healthcare in general. So there were lots of things in place to try to improve the cost. Here are just some terms that you should be familiar with when we start talking about healthcare reform. Pre-existing conditions, which are conditions that a person has before applying to healthcare. An individual mandate is a requirement that everyone must have health insurance or be subject to penalty tax. And this was in fact a part of the Obamacare or healthcare reform. Defensive medicine stands for medicine practiced in such a way as to reduce the risk of malpractice litigation, typically by the use of excessive diagnosing testing. Capitation is the payment of a fee or grant to a doctor or school or other person or body providing services there you go, providing services to a number of people, such that the amount of paid is determined by the number of patients, students, and customers. A single payer system is a type of universal healthcare that is financed by taxes that cover the cost of essential healthcare for all residents, with costs covered by a single public system. And universal healthcare is a healthcare system that provides healthcare and financial protection to all residents of a particular country or a particular region. Okay, so with healthcare reform, there were three new organizations, healthcare organizations that were put in place. Healthcare exchanges. Healthcare exchange is an online marketplace where consumers can compare and buy individual health insurance plans. Medical homes are organizations that provide comprehensive, coordinated healthcare to patients who are members and belong to that medical home. ACOs, accountable care organizations, or networks of providers that work together and share responsibility and accountability for managing all care services for at least 5,000 Medicare patients over a minimum of 3 years. So here's some questions about healthcare reform. Where do you stand on efforts to reform the nation's healthcare system? As we already know, our healthcare system is in fact broken. There are way too many Americans living without health insurance. There are way too many Americans living without access to insurance. So where do you stand on this point? What do you think should be done in order to fix this broken system? What role, if any, should the government play in healthcare and reform? Should healthcare be a political issue? Should it be politicized the way that it is and it has been for many, many years? Or should the healthcare of Americans be put on top of everything? Should taxpayers cover healthcare costs for poor people? That's essentially what happens in a place where universal healthcare is in place. What do you guys think about that? And should people be required to have health insurance or pay a penalty? There is a huge controversy about all of this. It was very difficult because people were mandated to get their own health insurance at the same time as having low income paying jobs and the responsibility of taking care of a family, a mortgage, and whatnot. So it all became a very controversial issue. Okay, so now we're going to talk about quality improvement in a healthcare setting. What we want to do with quality improvement is basically improve the quality of healthcare services, which is a top priority in hospitals, specifically in our hospital. Okay, just trying to move this slide forward. Okay, quality improvement, continuous quality improvement, CQI, is a way of using methods and tools to identify, prevent, and reduce the impact of process failures. By studying the process, you can determine if there is a better way to do things. Here's some goals of quality improvement. You want to eliminate adverse effects such as the patient falls in bed sores. You want to reduce unnecessary expenses such as keeping patients in the hospital longer than necessary, preventing undesirable patient outcomes such as hospital-acquired infections or medication overdoses. Okay, so moving along, PDSA stands for Plan, Do, Study, and Act. PDSA is an approach to improve processes within a hospital. It is more widely known as PDCA, which stands for Plan, Do, Check, and Act. Okay, so PDSA is really a process of quality improvement. Plan is for creating a plan or a test to see how a different approach would work. Do means implementing that plan to see what happens. Study stands for reviewing the results to determine what was learned, and act is taking action based on what was learned. In our hospital here at Valley, we use SBAR or SBAR. S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. This is a technique that can be used to facilitate prompt and appropriate communication. This communication model has gained popularity in healthcare settings, especially among professions such as physicians and nursing. In quality improvement, metrics are super important. Metrics are a set of measurements that quantify the results. So we in quality assurance like to look at data. Data is very important. Baseline data is information that is gathered before a change to better understand the current situation. So to assess quality improvement in quality assurance, we need some hard information that will come from data. We also need to analyze that data and see how our plans to fix something within the hospital, how it actually improved. And what we're trying to improve here is the overall quality of lives for patients. Outcome data is information that is gathered after a change to examine the impact or the results of our plan. Okay, so now let's talk about patient safety. Ensuring patient safety is a key goal in our hospital. And I think you're all very much aware of that. Medical errors are the third leading cause of death in the US. It is an issue or the difficulty understanding, interpreting, or estimating patient data. Medical errors are very, very, very critical, and they are, in fact, the cause of deaths. It's largely responsible for a cause of death here in the US. 1 million people are injured, and 98,000 die each year due to medical errors. Again, an error in a hospital setting is something done incorrectly through ignorance or carelessness. Okay. So, in terms of keeping our patients safe, workers have to speak up if they see a mistake or an error about to occur. We must try to prevent a sentinel event, which is an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof. The National Patient Safety Goals set in place in a hospital provide specific actions to prevent medical errors. Another issue that arises within the hospital is insufficient supply and demand. Insufficient staff, including nurses and other healthcare workers, can lead to serious quality and safety concerns. Keep in mind that millions of baby boomers who work in healthcare are very close to retirement. This could result in major labor shortages as baby boomers are increasing in the demand for healthcare services. To continue with this, 55% of RNs will retire in the next 10 years. A shortage of 1 million nurses will occur by 2020. We will need a supply of newly trained RNs, and right now, the amount of RNs that are supplied to healthcare settings here in the US is not enough to replace the RNs that are retiring. There is also already a serious shortage of geriatric doctors. These are doctors that specialize in healthcare for the elderly patients. Okay, so now we are going to discuss electronic medical records. So back in the day, I don't know if you ever experienced this because you're so young, but back in the day, we used to use paper patient charts, right? So everything was printed, everything was logged on paper, and everything was put in a manila folder and set in a hospital setting or a doctor's office in alphabetical order. However, that is not the case anymore. Pretty much everyone has moved towards electronic medical records. And right here in the hospital, we use everything electronically, and we don't keep as much, paper for patients' records. And this is actually a huge advantage for the way we care for patients now. Electronic medical records, or EMRs, are used in hospitals, in doctors' offices, and clinics where patients' information needs to be shared quickly and frequently among providers at several different locations. As patients move among providers, their medical information needs to be accessible wherever they receive care. So right now, the way that things work is that every hospital has a healthcare portal. So if you have been seen by a doctor in a hospital or even at your own doctor's office, you have the ability to log into your healthcare portal and view your results. Not everybody knows this information and knows how to access this information. However, more of the younger population will have, this kind of knowledge, and they will actually be very active in getting their own results and having their own records and keeping their own records. This is also very nice because if patients are going to different doctors from within, one umbrella of healthcare system. For example, if my cousin goes to a doctor that belongs to Hackensack Meridian Health, and this is a hematologist, she could also go to a gastroenterologist that works for Hackensack Meridian Health and be able to share her information with the other doctor. So doctors from the same healthcare system can easily access the patient's information. Now, the question is, can we integrate information so that doctors from different healthcare systems can view patient results? And I'm not sure if we're at that point just yet. So when providers can access comprehensive, up-to-date information on each patient, the quality and continuity of care increases, and the cost associated with unnecessary duplication of blood tests and radiographs, for example, decreases. So this is a great piece of information, and it makes a lot of sense. So if I have all of your blood work from 3 months ago, it may not be completely necessary to draw you again, or to run another CBC, another CMP, a BMP, because in 3 months, I'm not expecting your blood work to change very much unless you're ill, or unless you're going through something, or you've been diagnosed with something differently. So so this, in fact, it's very helpful to decrease the amount of blood work and blood tests that is getting done that is unnecessary, right? And also unnecessary blood drawing for the patient. Okay, some of the disadvantages of these electronic medical records, obviously, is you've got to train the staff to make the transition from paper to electronic. But I think most staff that works with it is now able to deal with this, and it's pretty competent at this point. Not all EMR systems work together. So again, if you're under the same umbrella, more than likely you can probably pull up patient information. If you're from different healthcare systems, like Barnabas Health and Meridian Health, you may not be able to access the information. Concerns about a breach, which is a failure or interruption in patient confidentiality, is obviously one of the issues that can occur, and it has already occurred because these these records are electronic. So that's something that the hospital has to work diligently with the employees, so that hacks and breaches don't occur in the electronic medical records. So what is the big picture here? Ask yourself some of these questions. Where do you fit into the big picture? Right now, you'll wear at least 3 different hats. You'll be the patient at one point, or you have been. You're also a taxpayer, right? And you are now a healthcare professional. I know you're just a student, but this is a pre-professional program, so we're preparing you to be a healthcare professional, okay? So each time you change a hat, your perspective will change. So you've got to be very, very open-minded. You've got to listen to opinions, and you've got to formulate your own thoughts. Your perspective is the manner in which a person views something. I just want you to keep in mind that no matter where you stand, okay, putting politics aside, maybe your own opinions aside, when you come here to work at the hospital, you've got to keep in mind that your patients must come first. Okay, so the safety of the patient is your priority, and this is why you are here. And here are some take-home points from this lecture. Remember that soft skills are just as important as hard skills in achieving success at work. Keep up to date with the business side of healthcare, where it appears to be headed and where it appears to be heading. Monitor current trends and issues so that you can discuss them intelligently with other people. Be on the lookout for technology and how it might impact your patients and work. Apply SMAR approach and statistical measurements to improve the quality of care. And monitor the national patient safety goals to avoid potential mistakes and errors. Think about the different hats that you wear, and always put your patients first, and consider what role you want to play in healthcare, and keep on learning. All right, this case study is actually one of the case studies that you've been assigned. So we can go over it right now, but we don't have to formulate an answer just yet until those case studies are due. So this case study says, why have the doctors who own the practice where Carla worked decided to give up their private practice and join a network? What changes will this mean for Carla? And should Carla stay to look for another job? If she stays, what could she do to prepare for the changes? Could she help her doctors, manager, and coworkers make the transition? What might happen if she leaves, and what would you do? What would you do if you were Carla? So these case studies, again, the actual case is not shown here, but we will actually have the cases. They're posted in your syllabus in the course, so you can go over those cases and answer the questions. And then I think when they're due, each one of you will do one case study. You'll present about 5 to 7 minutes, and then we'll have a whole group discussion about them. Okay, so this will end your lecture number 1, part 2 of your professionalism course.